Some diseases are one gene and some are polygenomic. And
Is balding a disease?
well, it's an entity.
So there's like balding, male pattern baldness, female pattern baldness, person pattern baldness, but then there's also like alopecia.
Hormonal hair loss as opposed to antibody hair loss. So
What's antibody hair loss?
we'll get there. Hormone hair loss is when you convert testosterone into dihydrotestosterone.
You're not putting things in layman's terms.
Well, it's hormone A being converted to hormone B. Once that hormone B binds to the follicle and triggers the loss, it falls out, and then each succeeding cycle gets shorter and shorter. So if you comb through your head, you'll see long hairs, you'll see medium hairs, you'll see short hairs.
Different types of cats. If you comb through your hair,
That's right.
you can see short hairs, you can see
Yeah.
grays.
Well,
What about like alopecia?
alopecia just means hair loss.
It just is hair loss?
This means hair loss, alopecia.
But what's it
alopecia
caused by?
areata,
Yeah, it's
which is
just
the name
little
of the
areas.
disease. Right, little areas of hair loss, but that's not hormonal. Generally speaking, alopecia areata, when you get the round bald spots, are caused by antibodies attacking your own hair. Now, why do you attack your own hair? That's what we call an autoimmune disease. And there are many autoimmune diseases, and some are life-threatening, and some are more cosmetic. Losing a patch of hair is not a problem. Losing all the hair on your head is called alopecia totalis. And losing all the hair on your body is called alopecia universalis.
Universalis, yeah.
And so, that's right. So now we're meaning everywhere, universal. But now you can treat the patches, usually sometimes with topicals, sometimes with small little injections, which don't hurt. But as it gets bigger, there are other things. Sometimes there are medications that you can take orally for the more extreme causes. And one of them was a drug that was developed for rheumatoid arthritis. This is for the more extreme form, and it works on certain genes called JAK genes, J-A-K, JAK1, JAK2, JAK3. And these genes also play a role in vitiligo, where you lose pigment.
Yeah.
And it plays a role in eczema, where you itch and scale in a variety of places on your body, but also alopecia areata. So they're all thought to be autoimmune diseases, where for some reason,
diseases though?
a skin disease like
So
eczema.
you would go to a dermatologist for alopecia.
You would go to a dermatologist for alopecia and for eczema and for vitiligo.
Obviously, eczema and vitiligo.
Correct. And that's the drug. One of the drugs is called Xeljanz, and and it's and the other one is called Jakafi. But both of these drugs work on these genes, and by suppressing them, very often the hair grows back. And we do have some patients that are using it where everything else failed. These have been successful. So this disease, which has been a very great challenge for as long as anyone's tried to treat it, not such a big deal in the limited stages. And I would guess that's about 98% of the people. But for those 2% that are more challenging, and there are a lot of people, 2% of the country who get this would be over 6 million people who get it now and then. They don't have it all the time, intermittently, but 2% of that number are the more extreme, and it's nice to have something to offer them that is reliable. And so far it appears to be relatively safe. So,
How do you know if you're balding from alopecia or naturally, or
well, natural hair loss has a pattern, like in men, the receded, the bald spots.
Oh, and then the alopecia is just the little dots.
They're like the round spots, yes. And most clinicians can recognize which is which. There are some situations where it's a little less clear, but most of the time it's clear. And if you biopsy them, you will see differences under the microscope, which helps you make a more definitive decision. And then there are scarring alopecias where you can't grow anything back, so you just want to prevent it from spreading. Those scarring alopecias are like things with fancy names like lichen planopilaris, pseudopelade, frontal fibrosing alopecia, which is we're seeing more in women these days. You just want to stop that from spreading further, because once it's scarred, these scarring alopecias, it's not retrievable. There's even a lupus of the scalp, which doesn't kill anybody, but it's you know, it's another challenge because it's another cause of hair loss that is not retrievable.
Yeah. Are there any things that would lead to your hair falling out, like a tight ponytail or wearing a hat every day? Are those like real concerns?
There's a thing called traction alopecia. If you wear your hair very tightly or you braid it very tightly, you can reduce the blood supply to those follicles. And yes, you can lose some hair from that if it's done chronically. It's not something going to happen in the short run. You can lose some hair over a long period of time, yes. And what can you do? Well, using these medications can reduce the hormones that can be a problem, but you also want to do something to try to replenish the blood supply. And one thing people are using now with varying success, sometimes it seems to be quite helpful, sometimes not so much, is PRP. PRP is called
platelet-rich plasma.
Correct. And the platelet-rich plasma is exactly what it is. There are platelets. You take your own blood, you spin it down for 10 minutes at about 32,500 RPMs, and the red cells go to the bottom, then the white cells and the plasma's on top. And the plasma that's rich in platelets are at the bottom, and you take that, you remove the platelet-poor plasma from the top, and you take the platelet-rich, load them into syringes, and put it back into the scalp. And it was originally...
And who does those, derms?
Derms do that, yes. And if you inject it into the scalp, it's hopeful that it will help improve the blood supply. And if it does that, the hair might become healthier.
I got this question. When do you worry about shedding, especially for women of color?
From traction? From braiding? Well, when do you start? Because you start thinning around that area. And first thing you advise them is to take it out.
Take out the braids,
yeah, take them out. I probably think some PRP would be helpful to revascularize it. And as I said, sometimes the medication that we suggested can be helpful in giving it a push.
Yeah.
So yes.
But also go natural for a little if you can, right?
Yes, that would help.
Maybe.
That would make my job easier.
Yeah.